We'll go with this as a final wrap-up question. I'm going to convolute this one together from a couple different audience members to try to, but it basically comes to cost. Basically wondering some of the programs that you're talking about, checking out the caregivers, training for law enforcement, the database for the medical marijuana cards. Where is that funding going to come from? And then another questioner wanted to know, is this something that they expect Obamacare to help take care of cost-wise? Will that support them?
You mean the health care bill?
Yeah.
I'm reading off of what the card said. The card said Obamacare, but yeah, the health care bill. Tony, do you want to go ahead and take that first?
I don't know very much about Obamacare, but what keeps being revealed scares me to death. I don't want to know any more at the moment. As far as cost, we've addressed that some. The Department of Health has the right to pass on. The bill says reasonable costs, so I'm assuming the cost of providing ID cards and so forth will be at the expense of the patient and or caregiver. As far as other costs, there's a lot of leeway for the Department of Health to set various regulations regarding how they manage this. So I can't answer what exactly they would do, but you should look up the cost of enforcing marijuana laws anyway and find out how many officers are detracted from doing other duties to do drug arrests for people that basically aren't harming anybody else in this country.
You're still going to have to enforce the new marijuana laws, and they're more convoluted, more ambiguous when the initiative's passed. Right now, possession of marijuana is against the law, but now, if you pass the initiative, it becomes more ambiguous. You can't. It's all over the place. And you have 3 plants, 6 plants, and I got to investigate it no matter whether you tell me you have 6 plants or 5 plants, so I have to look into it. Where before, it was easy. It's against the law. Now, more manpower resources, more to be dedicated because the law has all these loopholes in it now where you can have 6 plants, 1 ounce, you're a caregiver, you're a card holder, you're a visiting patient, you're not a visiting patient. It's more laws for us to enforce. You didn't take any off the books. It's more if you added them to the books. And as far as the cost of the Department of Health, I'll just throw out one stat. Here's a Colorado stat. In Colorado, they had to hire 53 new state employees to make sure to run their medical marijuana card program. Well, the state budget is already in deficit, so I don't know where we come up with the money initially. Tony says we pass it on to the card holders. Well, where do we initially come up with the program to hire these people to dispense the cards? And we can't make the cards so expensive that they're too expensive, so the state will never recoup their expensive. It's always going to cost the state money. And we don't have the money now. I don't know where we get the money with the card holders. So it's going to be a burden upon the state's budget. If it's passed, obviously we're going to figure out a way to do it, but there's no money to be had now. I don't know where he thinks the money's going to come from later.
I'm not an expert on the South Dakota state's budget or any government's budget, but I do know that lots of governments, our federal government, I'm sure a lot of state governments, seem to fund some rather amazing things with the taxpayer dollar. And perhaps they could stop funding some silly things like the sex life of the tsetse fly and use the money for better purposes. So I think if they really think that they need some money for a useful purpose of helping out some of the other people, that it would be better suited them for providing someone to do some study that nobody really gives a hoot about. So I think that there are ways, if you really think you need the money, the states really think they need the money for a variety of things, some of which we agree with and some that we don't agree with, somehow they find it. So I don't think it's quite as large an issue as you're trying to portray.
Trevor, do you have a 1-minute response to that?
I guess you got to go by what others happens in other states to predict what's going to happen here. If they had to hire 53 employees there, right now there's a state hiring freeze, if I remember right. You can't hire any employees right now. So how are we going to hire 53 when right now we can't hire any for a new program? Now there are probably wasted taxpayers out there, but again it goes back to if it were for a small group of people, maybe you could find the money for it. But when you're talking 20,000 card holders in Montana, where arguably only 2% need the card, how much money do we really need? That's what it boils down to.
Gentlemen, I want to thank you both for being here again. Ryan?
Thank you, folks.
Concluding statements? Any concluding statements?
Would you like to make a concluding statement, either of you, gentlemen? Or wind up statement?
Sure.
Okay, go ahead.
Sure.
I'll stay. I'm late. A lot of issues can be raised, a lot of things can be done. We can talk about what other states do and so forth. In regards to Colorado, they started dealing with dispensaries, and all of a sudden everybody went to open a dispensary, and that increased their staff temporarily to deal with the request for the right to open dispensaries. That's where most of that extra hiring came from. We're not gonna have dispensaries here. We're gonna have caregivers, designated caregivers. Now, I don't know if anybody, how many people actually want to go to the trouble of growing marijuana for very many people. Most of it, I think, are gonna be people that are friends or relations, but I can't guarantee that. Much as, I can't say that that's gonna happen any more than all of these statistics that Trevor showed us on his nice little presentation. All of those statistics are numbers. We don't have what those numbers came from, or why, or what they actually mean. I can throw out all kinds of numbers. So what they actually mean and where they came from, aside from the fact that the Montana law enforcement provides those numbers. Law enforcement does a lot of things. There are a lot of reasons why law enforcement, to be quite honest, don't want to see marijuana legalized. One of that is because that's the biggest part of their drug enforcement business, and drug enforcement gets a lot of money for budgets that aren't very healthy from the federal government. So it could affect their bottom line in terms of operating. But if that money is only for drug enforcement and not for dealing with things like whether or not a patient has marijuana, as opposed to trying to solve crimes such as homicide, fortunately in this state there isn't much of that, with rape and so forth, they don't direct that to things that really offend people, that really upset people, that cause people fear in their homes, instead of chasing down someone who has medical marijuana or someone who has marijuana that should be medical marijuana. Then I think there's a matter of priorities there that we need to look at law enforcement and ask them, what is it you really want to do with your funding? So then there's the method of, that is another black eye for law enforcement. That's the use of civil asset forfeiture, which is almost always drug enforcement related. Seizing property and most of the time not giving it back. There's a recent study out that came out from the Institute of Justice this year. It was published in March. It talks about this problem with law enforcement, and it looks very bad for law enforcement. It gives law enforcement another black eye, and it talks about these forfeitures, and it goes around and talks about the procedures that each and every state uses. In South Dakota, it's pretty loose. The state gets an overall grade of C. The highest grade offered is B for this, but it says that South Dakota law enforcement, when they seize this, most of the time it's cash, sometimes it's property, they don't have to account for what they do with it after they've seized it, because they're allowed to keep it. Many times, people can't afford to go through court to get it back because it costs more than what was seized. It's worth. So that's something else that goes hand in hand with all of this. But all these numbers that are impressive, but the numbers of people that are going, it talks about last stages of life. This isn't just about last stage of life. This is about people that are suffering long-term illnesses that have long-time problems, whether it's Pat over here with his MS he's had for 20 years, and he has spasticity, and he has little muscular seizures that throw him out of his wheelchair sometimes. And he would like to be able to do that. He says that as little as 3 puffs on a cigarette will stop that. And then he doesn't have it for a while. But these are what we're talking about. We're not talking about someone's going to sit around and just blow marijuana smoke all day long every day. That's not what this is about. That would be some recreational users that might do that, not patients. They're not going to do that. So again, we would say, please vote for this. Look for it as it is. It's the strictest law in the country. It takes care of most of the concerns that South Dakota has expressed before to us, and we've addressed those concerns. It's a safe law. It allows patients to get another medication safely without having to go to a criminal to get it. We'd like you to help those people. Thank you.
I guess I would throw out that if we're truly a good medicine, the American Society of Cancer, Cancer Society, those other groups, Glaucoma Society, the Multiple Sclerosis Society and the South Dakota State Medical Association, they would say it was a good medicine. And if it had been thoroughly tested and they'd be able to monitor your progress, they'd say it was a good medicine. This initiative doesn't allow for that at all, does not allow for that at all. It allows for people to grow the medicine in their basement unregulated, unsupervised. It allows them to distribute the medicine to the person for a whole year without ever seeing a doctor again. If it were truly about a doctor-patient relationship, they would narrow it down to the truly effective in this deal and also make it a medicine, appeal to the federal government to make it to be tested, etc. As far as law enforcement goes, be aware the person always comes to your office and says, I'm going to make your job easier. Okay? Because you're not making our jobs easier. You're just creating more laws for me to have to figure out to go run down for what we would consider an unsafe substance that's addictive, and when people are on the roads driving impaired, cause more accidents and more fatalities. Remember, I go back to the one slide I'll point you to is the age range of the people that use medical marijuana in Montana. They're your driving public. They're the people that are going to be on the roads driving to and from work impaired. And that's why your DWIs in Montana have increased. They're going to be more, anytime you put more people, allow more people to smoke marijuana, okay, that's what this initiative is going to do. It's going to put more impaired drivers on the road. That's a public safety issue, and that's what we're concerned about. Thanks for your time.
Thank you folks for coming. There were a few questions that came up that asked specifically questions aimed at the Tea Party or why the Tea Party was engaged. I put those aside because the three of us up here are not members of the Tea Party. I would encourage you to talk to Dr. Unruh or Mike Hosted if you have questions about Tea Party stances, because Trevor and Troy would not, or Tony. Troy wouldn't have been able to answer it either, but he's not here. Tony wouldn't have been able to answer them. But thank you very much for coming. I know Dr. Unruh is more than happy to talk to you about the stances of the Tea Party. And we'll talk to you soon. Thanks for following this and vote November 2nd.